Physiotherapy is a great career to go into. There's always going to be a need for physios. You're always helping people, but in so many different diverse areas. So whether you're working with like elite sports people, or whether you're working with people who are recovering from a car accident or from a stroke, it's so broad that you can't really get bored.
The 3-year course. We have a mixture of theory and placements. With that, students do over 1,000 clinical hours, so they get to put into practice all those skills that we teach.
The units, so we've done progressing physiotherapy, where we kind of build upon all the skills we learn in first year and second year. We do a research unit, which is our dissertation, so we do a systematic literature review, and we get the opportunity to get that published, present it at conferences. The lectures are really good, they're really friendly. Because it's a very small course, only 25 of us at the moment on the course, you get really good contact time with the lecturers.
So this year I've only had one placement so far, which has been in neuro, particularly stroke, which was incredible. You meet some incredible people and you get to work with lots of different disciplines as well, so you get a wide range of experience.
So they have 5 6-week placements, but one of the things that's a little bit unique is that they have a placement really early on. So within their first year of coming to Bournemouth University, within a matter of weeks of being here, they go out on what we call an orientation placement. So it's only 1 week long, it's not graded, but that's opportunity for them to get out there and just see what happens in clinical practice.
My favourite placement was musculoskeletal, and you get really hands-on. You do all the your typical physio things that you always think about, all the stuff that looks really cool. There's someone that came in with neck pain, and straight away I remember something I'd learned in uni in this room. Did some movements on their neck, and at the end of it they'd gone from having movement kind of just like this to being able to look fully over their left and right shoulders, and that's just in the space of half an hour.
Yeah, so we try and make sure that when our students graduate that they've had a range of experiences on placement. So we always try and make sure they get a good cardiorespiratory placement, neuro and musculoskeletal, so as they're set up for when they graduate.
So by practicing our skills in uni, it means that when we're on placement with real people and real patients, we have them as smooth as possible, which makes the patients feel far more comfortable. So the support we get is really good. If we have any questions or anything, we can always ask, and because our classes are quite small, there's only 27 people in our year, it means that there's always someone to ask or to show us how to do things that we're not sure of.
We use a range of different methods for assessing the students, and that's because we understand that everyone is different and unique, so not everyone is going to do amazingly with doing essays.
It's really cool that back in January, so 6 months before I finished my course, I'd already had my first job offer, first job lined up, which meant that I can relax a little bit more, take the pressure off going into final units.
We try and organise opportunities for guest speakers to come and talk to our students. So for example, this year we've had the GB Paralympic football team come in and just talk about their experiences of what it means of being a high-level athlete, but also with a disability. In terms of work experience for candidates who are applying for the physiotherapy course, it's really important that they try and get a breadth of work experience so that they have insight into the diversity of physiotherapy, particularly within a National Health Service context, so that they understand that physiotherapy isn't just about outpatients, although that's a really important part, but there's also the cardiorespiratory side, the neuro side.
You get to help so many different people in so many different areas. Physiotherapy is such a rewarding career.